I am Lindsay Lair, presenting a real-world study characterizing symptoms and impacts of fatigue in U.S. adults with relapsing multiple sclerosis using a novel disease-specific scale. I would like to acknowledge my co-authors, Dr. Lauren Krupp and Dr. Lee Charvet of New York University, Carol Jameson of Janssen Research and Development, and Marion Azoulay, Tiffaine Levy-Heidman, and Valentin Morisseau from the Serenity team. These are our disclosures. Fatigue is among the most frequent and disabling symptoms in patients with relapsing multiple sclerosis and a main cause of impaired health-related quality of life. This study was aimed at measuring MS fatigue symptoms and their impact on daily life in a real-world population using a self-administered online questionnaire, including the novel RMS-specific FSIQ RMS patient-reported outcome instrument. This is an ongoing, non-interventional, prospective longitudinal study of ambulatory adult RMS patients. This is the baseline assessment data of 200 patients from the U.S. The FSIQ RMS is a 20-item questionnaire that addresses the symptoms of fatigue, rated for severity based on the mean of a daily symptom assessment over 7 days and corresponding impacts of fatigue on 3 subdomains: physical, cognitive emotional, and coping. These are the patient and fatigue characteristics. A majority of the patients were female and experienced fatigue daily and before their MS diagnosis. Heat exposure was the most common triggering factor for fatigue. Fatigue was rated as the most impactful symptom on daily functioning, followed by walking difficulties. Patients with lower disability, as measured by the PDDS, tended to rate fatigue as the most impactful symptom on daily functioning. Nearly half of the patients who worked had to take time off because of fatigue within the last year, with most patients taking 1 to 5 days off. FSIQ RMS domain scores range from 0 to 100, with higher scores indicating greater severity. Subjects reported high levels of fatigue and associated impacts at baseline as assessed by the FSIQ RMS symptom and impact subdomains: physical, cognitive, emotional, and coping. Fatigue levels were significantly higher in patients with self-reported relapse, depression, and/or sleep disorder than in patients without these characteristics. Fatigue levels were significantly higher in patients with pain than in those without pain. Regardless of the time since diagnosis and treatment with high-efficacy disease-modifying therapies versus other DMTs, the fatigue levels were not statistically significantly different. The MS-specific FSIQ RMS characterized the real-world impact of MS fatigue. MS fatigue occurs daily and influences day-to-day functioning for most with RMS. Fatigue increases with symptom exacerbation, depression, sleep disorders, and pain. The FSIQ RMS is a novel MS-specific assessment that can advance the understanding and management of fatigue. Thank you.